My name is Lucina, and I have Lyme. These are my sons, and they have Lyme.
This is my sister, and I have Lyme.
I'm their grandmother, and these are my daughters, and I have Lyme. We're living proof there's Lyme disease in Texas.
I was training for a marathon. I was at probably one of my best physical conditions in my life at the time. That's when I knew exactly when I contracted it, because it all changed. 15-pound weight gain in 2 weeks, flu-like symptoms, always cold, always chilled, sweats, sleep 15 hours a day. I'm one of the blessed that I got diagnosed quickly. Some of the people that I've just met that y'all will be seeing have been suffering for years, and I just can't imagine the frustration and the pain they've been going through.
Myth number 1, there's no Lyme disease in Texas.
Myth number 1 is probably the most difficult barrier faced by Lyme patients in the Lone Star State. Simply stated, most physicians in Texas think that there's no chance that their patient has Lyme. This comes from several misconceptions about the disease, including its very presence in the state.
It was established to be in Texas in 1984. All 11 public health districts have reported cases. The CDC maps show that it's endemic in about the eastern 2/3 of the state. And yet we have insistence in the community that there's no Lyme disease in Texas.
Another misconception is that Lyme can only come from outside the state.
Yes, the bacterium has been isolated in my laboratory, and that we have amplified DNA from this bacterium, and that's what we can say that yes, the pathogen is here in Texas, and yes, Ixodes scapularis is here in Texas. So if those two, the pathogen and the vector are together, we cannot say there's no Lyme disease.
Myth number 2, I would have known if I had been bitten by a tick.
Using a tick bite as the sole reference for pursuing a Lyme diagnosis can be tricky. There's only a 25% combined chance you'll even notice the tick bite that gives you the Lyme disease. The ticks that transmit Lyme disease are no bigger than a poppy seed, and once the tick falls off, the bullseye rash is what the doctors look for. The rash actually appears only 50 to 60% of the time and presents its signature bullseye shape even less often than that.
Myth number 3, my doctor would know if I had Lyme disease.
He gave me the Western blot test and came back negative. We actually did it 2 or 3 times. He told us basically about the problems with the test, and he told us to get tested with, or told me to get tested with IGeneX. And it came back positive, so that's when we knew at least what it was.
The lack of accurate blood tests, along with many other factors, is the reason that a clinical diagnosis based on symptomology is the way most patients are declared positive for Lyme disease.
This was a child that was literally falling apart at the seams, and all the while the mood swings were getting more and more erratic. And so I became very frightened and started to see doctors. First the pediatrician, of course, 3 or 4 different times with different symptoms each time. Leg pains, and they said they were growing pains. The doctor said, well, we've got gastrointestinal problems, go to the gastroenterologist. So then let's send you to a psychiatrist, let's send you to a infectious disease doctor, let's send you to an oncologist. And then they did some blood work and that wasn't normal, so off we went to MD Anderson. He would fall off the couch, he was having electrical heart shock feelings. And then he started to get muscle spasms and twitching, and got to the point where he would just scream, lay on the couch and scream. And the doctor said, it's probably psychosomatic. We finally went to a doctor who said, after our third visit, after the EKG, after the CAT scan to rule out a brain tumor, he said, I'm going to test him for tick-borne disease, but I don't think there's any Lyme in Texas, so I'm just going to go ahead and run that because we pretty much looked at everything else. So he did run the test, and when I got the results back, of course they were negative, but I thought, well, I'm going to do my homework and find out why would he run that. I don't know, he didn't tell me. These are the symptoms that make me think that's a possibility. So I looked it up on the internet, and when I got the symptoms for Lyme on the screen, I just started crying and crying because that was it. Myth number 4, Lyme disease is hard to catch and easy to cure.
I was at the camp and I felt them on me. There was more than one, and they were just on my legs. And it goes to its hiding spot at once, and it injects you or bites you, and you got it.
One other fact that we just found out when we got back is that I have given Lyme disease to my wife. So now my wife has Lyme disease, that I gave it to her. And that's just a horrific feeling that I would, that this would happen to her. And I was the cause of it. We've also been told that children born with mothers who have Lyme can get it through the fluid, embryonic fluid. And so they're born with Lyme disease.
The biggest problem with treating Lyme disease is that most patients aren't diagnosed until it's too late for an initial round of antibiotics, and the disease has become chronic.
We have a lot of friends that say, well, why is he not getting better? Well, he is. It takes time. This is not something that, you give antibiotic and it's gone. It could be years. This is, it's a treatment that takes a long time.
Chronic Lyme treatment involves tackling 2 problems. The first is attacking the infection with megadoses of antibiotics.
This is normally what your bag of medicine looks like. They vary in size, milligrams, grams. You mix it, you connect your lines, your blood thinners, your fluid flush, saline flushes. Everything has to be sterile, so these are what you use every day. So you can imagine how many I've gone through for 2.5 years.
The second part of treating chronic Lyme disease is dealing with the damage done by the bacteria.
And this one is keeping me out of heart failure right now. And heart failure is not something that a 38-year-old should deal with. And this is not even everything. There are some things that don't travel with me. This is typical of what a patient with Lyme disease takes whenever they're in treatment and beyond.
Ask any chronic Lyme patient, and they'll tell you that early diagnosis and proper treatment would have changed their lives.
And one day, my body just broke, literally July 9th, 2009. And I never went back to work.
If you treat it wrong, you can have horrible results. Bad results. And just try to catch it early.
Help us dispel the myths about Lyme disease in Texas.
Texans need you.
If you are a patient or doctor who has encountered an unusual array of symptoms whose cause hasn't been identified, then please consider the possibility of Lyme disease. For more information about Lyme disease, its symptoms, and its treatments, visit our website at txlda.org. There is Lyme disease in Texas.